Hi Disha,
Hi,
how are
hi
you?
Nisha, how are you?
I'm good.
I'm
I'm
good,
good. How are you doing?
good. So, am I audible?
Yeah, there's a little glitch.
Okay, am I audible?
Yeah, now it's better.
Okay, okay. So,
Okay.
I'm happy
So
finally we are doing this live after like so
yes,
many days of planning. Finally, we got time to do this.
right, right. So much I had. There was too much of to and fro between us with the dates and days and timing.
Yeah,
Good, good, good. So let's begin our show for today. A very warm welcome to all the mommies who are joining us. And as we all know, once we become a mother, we stop being a picture and we start becoming a, like we start being a frame. And as we all know, everyone's journey through pregnancy is different. Everyone's birth experience is different. Everyone's body is different.
right.
But there's something which is very common. The moment we become mother, we become
Hmm.
pregnant. There are few questions that every mother starts thinking from the day. What is the good posture to sit, how to stand, how to walk, how to
Hmm.
sleep, why is back pain issues, which uh, which thing is comfortable to sit for, whether it should be a
Hmm.
sofa or a chair or a lying couch or what exactly. And not only that, the how question starts right from the morning when you get from the bed to when you're
Hmm.
walking, sleeping, you're sitting. And trust me, mommy, you're not alone into this. Everyone faces the same issue. And to put a question mark which mothers actually raise, that why this is there, what is the good posture, what is the importance of good posture, not only
Hmm.
for the mothers but also for the babies. So today we are here with our next expert. Let me introduce her to everyone. She is a CAPA certified childbirth educator. She's a prenatal fitness expert, yoga and gut sanskar coach. She is founder at Her Health and Her, and her mission is to create a world for healthy mommies and babies. Oh, please welcome Disha Nayak all the way from Mumbai.
Thank you. Thank you so much for a lovely introduction. I'm very happy to be here and share my knowledge with all the
Pleasure
mommies
all
and
mine,
mommies
Disha.
too.
So, Disha, why don't you share with us what exactly motivates you to begin health?
So, basically, even in my UG physiotherapy days and my postgraduate physiotherapy days, I was like very much interested in women's health. Okay,
Hmm.
so I did my specializations in that. I did various courses in that to focus on women's health because a girl's life starting from puberty, adult, pregnancy, post pregnancy, menopausal, there are so many changes that a woman goes through in her pregnancy. Starting from the time she turns 12 or 13, she starts her periods, to the time she goes through the menopause. Lot of postural changes, physical changes, mental changes, and everything. And a woman is a backbone of her family. A healthy woman will be a healthy baby and a healthy family. So I have always been very passionate and very much interested in women's health and helping women in all stages of life to lead a good, healthy physical and mental life with good nutrition, good exercise. So that's what led me to start Health and Her. We have various programs. We have pregnancy related programs for pregnancy fitness, diet consultations, postpartum fitness. Even for postmenopausal women, we have exercise programs for even for girls in puberty having PCOS. So that's why it's a very holistic approach, and it's a field that I can connect to and I'm very passionate about. So that's what led me to start Health and Her.
Wow, that's really nice. When a woman supports women, there's nothing better than that. Because they
Yeah,
are
nothing.
emotionally connected to it. They're always a very personal touch connected to that.
That's right. That's
They're
right.
So let's begin with our topic today and let's discuss the details of pregnancy and posture. So please
Right.
help us understand how are these two related? And what is the
So,
importance of that?
so in pregnancy, there are a lot of changes that happen in pregnancy. As soon as a mother conceives, as soon as a woman conceives, the baby is growing in her belly, the uterus is expanding, there are hormonal changes. So there's a hormone called relaxin which relaxes various joints and ligaments. Basically it helps to, like prepare the pelvic floor and the muscles to loosen up for birth, which is quite tight otherwise. So all this have a lot of effect on posture. As the so there is this center of gravity which holds you in your erect position when you're standing. Like when you're standing, you don't just fall off. When you're standing and sitting, you just don't fall, right? You maintain your
Mhm.
posture. So your muscle, a lot of factors are working on it. Like your muscles are working. There are anti-gravity muscles in your body. Basically, you have a system in your body, okay, that helps you to stand. आप ऐसे ही गिर नहीं जाओगे, चलोगे, तो you're able to maintain that posture.
Right.
And वो system has a lot of parts in it. So when you get pregnant,
Mhm.
all those parts which form that system to help you maintain your balance, your posture, gets affected. Okay, mainly being the growing belly. So the spinal curves, the curve of your back also increases. So your spine is made in such a way that it can absorb shocks. Like if you're holding something, you will not immediately collapse or hurt yourself. But if you maintain a poor posture in pregnancy, or if you don't take care of this in your pregnancy, slowly your posture deteriorates even more. So even in your old age, if you do not maintain a good posture, a good diet, that has a lot of bad effect, right? That's why posture and pregnancy is a very important topic. Posture in pregnancy is often, neglected. Like mother takes care of her diet, what she eats. She even exercises, but to prepare for vaginal birth, कि अरे exercise करेंगे तो फिर normal delivery हो जाएगी, ये हो जाएगी. But exercising for posture, exercising to, which forms, though over a time, poor posture can cause these natural curves to change their shape and leading to excessive amount of pressure on those curves. That's why maintaining a good posture, maintaining the alignment of your spine, doing the proper exercises under guidance is important.
Can you see me?
Yeah, I can see you. I think you froze in between.
Yeah, no, I
My
think there's
net's
some
fine.
glitch.
Okay. Okay.
Yeah,
Right.
now it's better. I'm
Yeah.
so sorry. Yeah.
Yeah. Hmm. Okay, so as I was saying, the various changes that happen in pregnancy, like the growing belly, even the breast size increases to produce milk, so that causes hunching of the back, rounding of the shoulders. उससे कभी कभी
Okay.
neck pain हो जाता है. So then अगर neck pain हो रहा है, you won't get a proper sleep. Proper sleep नहीं हो रही है, you will get headaches because of that. So it's everything is related. One thing is related to other. Poor back posture will lead to knee pain. So
Okay.
that way, slowly, you will experience a lot of more discomfort than you would have if you had taken care of your posture right from the beginning of your pregnancy.
Okay. Okay. So help me understand the thing when you're saying beginning of the pregnancy. So what is the right time to go and consult someone or maybe look forward for your postural changes and for guidance?
Right. So see, basically, even if you're not pregnant and you're getting a lot of neck pain because of long posture, like, these days a lot of women work on computers, work on laptops, sit for a long time, do not get time to exercise. So even they should start working on their posture, but especially when you get pregnant, second trimester and the third trimester is the time when the majority of the posture change will start, like after 15 weeks or so. पहले
Okay.
पहले का टाइम द फर्स्ट ट्राइमेस्टर में उतना फिजिकल डिस्कम्फर्ट नहीं होता. इट्स मोर ऑफ द हार्मोनल थिंग व्हेन यू गेट नॉशिया, when you feel weak. So that is the time when you start working on the right posture, forming the right habits. For example, uh, it is not advised to sleep on back. It's fine in the first trimester because that kind of puts pressure on the vessels that carry blood to the uterus and to the heart. So later on,
Right.
it is not good. But you
Right.
can start forming a habit to sleep on the side, to sit in a right way, to hold things in a correct way, so that in your second and trimester you have minimal physical discomfort.
Okay. Okay. And also help me understand, there are a lot of people, there are a lot of doctors also think that if you have a poor posture, not only you will get affected, but the baby also gets affected by that. So how is this
Yeah. So
connected?
what happens is basically, like, see, if your belly is growing, right? So if your
Mm-hmm.
belly is growing, your center of gravity is shifting. That is increasing the curve of your back, putting more pressure on your pelvis. So baby ka space bhi affect hota hai. If you talk about the upper back posture, if you have hunchback, this part of your abdomen also gets compressed, so baby's position is also, if you're not maintaining a correct posture, the space the baby is getting, you're affecting it, that if affecting the baby's space also in a certain way. So that's why the baby's growth is affected. Then later on towards the third trimester, end of the third trimester, the baby's head moves down, right? So if you're not doing the correct exercises, correct exercises, not maintaining a proper posture, that can be affected to a certain extent. The
Okay.
babies
Okay.
descend down towards the third trimester.
Right. So, is there any such trimester-wise guidance that a mother should be taking, or in the general tips that these positions should be avoided during the pregnancy, in the first trimester, in the first, second, and in the third trimester?
So, see, basically, in the first trimester, basically, there are very few changes that occur in a mother's body. Like structurally speaking, a very few changes that happen. So, first trimester is basically getting into the habit of good posture so that you don't really suffer or you don't have that many physical discomforts, like but first trimester is also a little bit of sensitive time, so usually your workout or your exercise begin after your 12 weeks. But little bit of neck exercises, walking, and those all exercises, if your doctor permits and in guidance, are fine. So that is what you should do in your first trimester.
What
But
should they?
then
Sorry for interrupting, but what should they be avoiding in first trimester?
So basically, basically sitting in a wrong way, in a sway back posture without taking proper back support. Okay, so basically, all these wrong, what I'll be telling you in different, in lying down, in sitting, in standing, what all positions you should avoid. So basically the thing is ki agar first trimester mein they are doing these things, in like they are sitting in a wrong way, so that may not cause so much pain in the first trimester, but the effect of that thing will be more in the second and the third trimester. And then it will be very difficult to get used to sleeping in a particular way, lying down in a particular way. So it's best that you start getting into a habit to maintain that posture. Then certain things like, maybe lying on your tummy. Many of us are used to sleeping on your tummy. So when you're pregnant, when you know that you're pregnant, you're already 6 to 7 weeks done. By the time you get your test done and everything, right? So that will not really harm the baby if you've slept on your tummy once or twice in the first trimester. But third trimester, obviously, you cannot do it. So that's how you should start, making yourself ready for the second and third trimester specifically. Then say if you're standing, if you have a job of long hours of standing, anything doing for too long is should be avoided in pregnancy, be it first trimester or second trimester. So what you can do is you can use a small stool, keep your leg up on the stool while you're standing. That will take away some pressure from your back. Then sit in between. If that's not possible, you can change your legs. Put your right leg up, then put your left leg up, take a small walk. Your pelvis, tilt it, don't tilt it outwards, tilt it inwards. Don't, curve your lower back excessively while standing. Then in lying down, post 15 to 16 weeks, it's advisable to lie on the side, because if you're lying on the back once a while, that's fine. So like ऐसा नहीं है कि 5 minute के लिए भी if you've slept on your back it harms the baby. It's not that much also, okay? But you have to be conscious, like while you're sleeping you need to sleep on the side. um, you can use the support of the pillows on your back, on between your knees, behind your shoulders. And you don't really need to overbuy stuff like buying the pregnancy pillow and all that. You can easily do with normal pillows and arrange it accordingly also. Then comes sitting. So when you're sitting and working, if you're working for a really long time on the computer, on your laptop, one thing to remember is that do not sit with a sway back posture like this. Always support your lower back. Your shoulders should not be up. You relax your shoulder, and your feet should be on the ground, touching the ground. And the level of your knee should be at the same or slightly lower than your hip level, not up towards your tummy. Then one the posture that should be avoided in later part of your pregnancy is excessively bending your knees while lying down on the side. Definitely not more than 90 degrees. So when you're lying down on your side and sleeping, you have to bend your hips and knees, but do not bend your hips excessively towards your tummy when you're asleep. You can use a wedge pillow to support your tummy down. And if at all you have to lie down for a while on your back, maybe for comfort, you can maybe use 2-3 pillows, and your upper back should be a little up, like about 45 degrees. So then again, that doesn't put that much of pressure on the vessels that supply the uterus or your heart, so that reduces the discomfort.
So, Disha, also, as you just mentioned about the sleeping positions, the sleeping
Right.
position needs to be altered every trimester wise, the way with the growing belly. You should be changing, or there is one position where you go ahead with.
No, so see, as long as you're comfortable in that position, basically the rule is do not sleep on your back for a long time, because that compresses
Right.
the vessels. So you are sleeping on the side. Generally, you're advised to sleep on your left, because it takes off the pressure from the liver and the other organs, so you're more free. But studies have shown that sleeping on the right is not that bad. You may want to turn a little bit on your right and sleep. That's fine. It's not going to really harm the baby. But if you're sleeping on your left, for example, in the initial part of your pregnancy, you may not need that many pillows behind your back and supporting your belly. But as your belly grows, you may need to support your pelvis also a bit. So again, that depends on how the belly is, how comfortable is the mother, um, what problems is she facing. If she's comfortable, she has no backache, she's very, she's getting a good sleep in that particular position, you don't really need to make changes. But
Right.
if you're not getting proper sleep, you should definitely seek advice and get your sleeping posture corrected, because that really helps a lot. If your posture is corrected, if you're using the correct pillows in a correct way, your pelvic pain, your back pain reduces to a great extent.
So, also help me understand that what is the importance of a good posture? We know that it should be done this way. Like also, but what is the importance? Why this is something that everyone suggests that good posture is important.
Yeah, so basically, good posture will reduce your pain and aches.
Mm-hmm.
Maintaining a good posture. So basically, there's nothing like a bad posture or good posture, or ye doing this is totally wrong, doing this is totally right. But there is a certain curvature of your spine. There is a certain alignment of your organs and spine. So if you're sitting, if for 2 minutes, if I have a sway back posture and sit, it's not going to affect me. But the posture is affected, your muscles are affected if you're getting into that habit of sitting for long durations, for many days, for years, and so that's when the changes will occur in your spine, in your shoulders. So that should be avoided. And one important thing of maintaining a good posture, or rather than maintaining a good physical and mental health, by maintaining a good posture, is exercise. So exercise may, it does not really mean कि exercise कर रहे हो मतलब it's only stretching or strengthening. Exercise also includes relaxation exercises, relaxation of your organs, relaxation of your back, isometric exercises. So all these exercises should also be included in your routine to help you relax. So if you're too stressed, like agar pure din if you have to sit and work on your laptop and your shoulders are up, you need to relax them also. You need to stretch your neck flexor, side flexor, that's fine, but you need to relax your shoulders also. So practicing relaxation exercise, there are a lot of techniques, Jacobson techniques, a lot of techniques that are there, which we also
Right.
do in our sessions and all. So those techniques can be used to relax your entire body from your feet. Also taking frequent breaks from sitting for a long time, from lying down, or from walking for a long time, standing for a long time, that's also important. So that's a part of maintaining a good posture. Good posture doesn't mean to keep your neck essay, don't keep your neck slighted. Okay, so it's basically keep changing, keep yourself flexible, take support when you want, so you have minimal discomfort in your pregnancy. If you had minimal discomfort in your pregnancy, even postpartum, it will be easier for you to recover your, because what happens is कि maybe अगर pregnancy में उतना pain नहीं हुआ हो, maybe you didn't have so many physical discomforts in your pregnancy, या aches उतने नहीं हुए हो, that increases postpartum because you're breastfeeding. And a lot of times mothers who exercise in pregnancy.
Just hold on, mommies. I think there's some network glitch from Disha's end. She'll be back. So, Rupali, I'm going to take your questions. Wait for 2 minutes.
Yeah.
Yeah, Disha, you're back.
Yeah, sorry.
Right.
So yeah, so I was saying a lot of times mothers who are so conscious about the posture, about the pregnancy,
Right.
about the way they are, about the way they are sitting, lying down, everything, they are not so conscious in the postpartum, in the fourth trimester. So again, that's a very important thing. I feel more than pregnant women, new mothers should concentrate on their postures of breastfeeding, using the right pillows, because they are going to be very sleep deprived in the fourth trimester. So doing that is very important, more so in the fourth trimester, in the postpartum phase, because postpartum mein jo healing hogi या जो नहीं होगी और जो effects होगी, that will be carried with you for a long time in even your old age. So उसमें it includes diet, yeah, because if you're breastfeeding, your baby is taking a lot of your calcium also from your bone. So if you're not having enough calcium, the baby is going to take the calcium. So you need the right nutrition. That's why your snacks are helpful, right? Because they provide the correct nutrition. So baby is going to take all the nutrition the baby needs. But you may not be able to get that kind of nutrition. So your diet is important. The postures you maintain is important, and you may not start a full workout in initial phase of your postpartum, but you should always do neck stretches, a little bit of back stretches, very mild. Under guidance, you can ask your physiotherapist and whoever you consult, whatever, which are very safe for you to do, and start working on them, doing a bit of walking or whatever is comfort and whatever works for you or whatever your problems are.
So Disha, help me understand this. Now, there are some mothers who have lot many complications during the pregnancy, and there are also mothers who are actually on bed rest for the entire 9 months. So definitely
Right.
cannot work on any of their postures, whether it's
Yeah.
standing or. So is it possible to fix that poor pregnancy posture postpartum?
So see, you can work on your body anytime, and you can, work on it and get back to your normal self. And the same works if you have exercised for say 5-6 years of your life, but then you stopped it again, you will get those aches and pains. So anyway, it's a long term thing. It's not कि आज किया तो कल भी रहेगा. You have to maintain it, right? So, agar there are few conditions in pregnancy where they are put on a bed rest, like if the cervix length is short or the
Right.
placenta is low or any such, in which exercise or even say plain moving around is also contraindicated to save the baby. So, at that point, saving the baby is the most important thing. So that time you will not be thinking obviously about the exercises, but there are certain things you can do even in your bed, like certain very easy neck exercises, hand exercises, very easy exercises, very basic exercises. So that will help you to maintain your circulation also, but those should be done only under guidance.
Right.
And postpartum, when you've delivered, you should start working on it with the help of a physiotherapist, with the help, under the guidance of your doctor, under the guidance of your physio. And there's nothing that cannot be fixed, but you will have to work towards it. If you just leave it, then yes, that will be carried on to a long time in your old age also.
So I think well explained the topic, and we have few mothers who are asking questions. Let me take this first one. We have Pali. She's asking, I had gone from C-section 4 months ago. I have a lot of pain, knee, knees and hip bone, and I'm breastfeeding mother. Can you advise something for that?
Okay, so when did she undergo the C-section? You said
4 months.
how many months?
4 months.
4 months. Okay. So first thing, the main cause of the knee pain and the back pain is the weight gain, the pregnancy weight gain. So first thing is you need to lose weight. Not doing some erratic diet, but just by slowly start getting your exercises, walking maybe, or doing some very basic exercises under guidance. Doing knee strengthening exercises and back exercises will help you with it. And again, as I said, if you're getting a lot of back pain, say upper back pain or lower back pain, and you're breastfeeding, you need to check your breastfeeding position as well. Just say for example, one thing what I can share with you is when you're breastfeeding the baby, when you're feeding the baby, you never slouch towards the baby and take your breast towards the baby. You always bring the baby towards your breast, hold it. So that's one point. Then you need to, like, stretch a bit of your neck and shoulders after breastfeeding, because if you're sitting like this holding the baby for a long time, they get stressed. So just do maybe rotations, side flexions, that's also okay. And start taking a proper diet which includes good calcium and iron.
So we have the next mother asking, I'm 3 months pregnant and my job demands more of standing time. What
Right.
effects have on my body and what can I do to manage it?
So, see, standing for a long time, what can happen is if you're standing for a long time, the circulation is affected. Plus, uh, plus, there's a chance of varicose veins also in a long run, maybe not in your pregnancy, in a long run. So it's very important that you're not standing at a place for a long time. If you have to stand, you can sit for 2 minutes. You can keep a chair closer to you, just sit for 2 minutes and then again stand back. You can take a short walk. You can perform certain back stretches. um, or I can say you can use a stool. As I said earlier, stool, and keeping a leg on the
Right.
stool takes away a lot of pressure from the back. So you can do these small changes. You may not again like get to sit for half an hour or so, but even 5 minutes of sitting after every 20 to 30 minutes of standing, 5 minutes of sitting will do a good. So try doing that. If not, try keeping your leg up. If you have to stand and there is like no option, try keeping your leg up on a small stool and working.
So the next mother, Madhu, she's asking, I'm at the end of second trimester and a lot of neck pain and pain between the shoulder blades.
Sorry, I couldn't hear you.
So the mother is she's in her second trimester.
Second trimester.
Yeah, and she faces a lot of neck pain and pain between the shoulder blades.
Yeah. So basically what happens is second trimester onwards, your belly starts growing a lot. So as I explained, the curve of the back, ये जो नीचे वाला curve होता है lower back में, like this, that increases. पहले इतना होता है तो ज़्यादा हो जाता है because यहाँ से baby, यहाँ से tummy भी grow हो रहा है, right? Second thing what happens is कि your breast is also increasing in size. So there is a lot of weight on the front which was not there. So if there is weight, like this is the weight and these are your back muscles, right? So they hunch, they slouch a bit because back के muscles उतना weight नहीं ले पा रहे अभी from the front of your chest. So थोड़ा सा वो slouch हो जाता है. So for that you need to keep your shoulders straight. You need to work on your shoulder blades, like doing shoulder blade exercises for uh, also your pectoral skill exercises, push-ups. So when I say push-ups, there are a lot of modified push-ups that are available. So push-ups don't really mean those push-ups. There are a lot of modified options that can be very easily done by a pregnant woman. So you can do those, which will help you to stabilize your scapular muscles and which will basically help you to develop a good strength in your upper back muscles, so the pain will reduce.
Perfect. So I think this is the last question for the evening. This is mother asking. She gets a lot of cramping. So what can she do for that? In fact, cramping is one thing that's very common in pregnancy.
Yeah. So that's like a part and parcel of pregnancy because of the fluid changes that happens. But a lot of time cramping happens at night when you're sleeping and suddenly you get the cramps. So
Right.
for that, it's important to maintain a good electrolyte balance. So having coconut water, having good amount of fluids is important. Secondly, doing calf stretches and ankle rotations before sleeping or whenever you get the cramps will help you ease the pain. But that's also a phase. There's a phase in your pregnancy around 2-3 weeks you get the cramps, and then it reduces. So again, that's also important to keep in mind that it's a phase, it will pass. Do these 2-3 small things and it will help you.
Right. So I think this mother named Sonal, she's asking how to deal with postpartum section. Although it's not related.
Yeah. For that, you need to show your dermatologist.
Not the physiotherapist.
Yeah.
So, as we are toward the end, Disha, why don't you share the 10 quick tips to put all our mothers for maintaining their good posture during pregnancy and postpartum?
Yeah. So first thing, I would like to share is like being aware is very important. Being aware ki what works for you, what doesn't work for you.
Yes.
What is your job? What is your job? If you have a sitting job, if you have a standing job, or maybe if you're working going to office in local train, or a metro. So what is that you are doing, and how your pregnancy is going to affect your body. So being aware of that is first thing that's very important. And ask for help. Ki, like ask questions, ask your healthcare provider. Second is exercise, but in exercise also include your relaxation exercises, which helps you to mentally and physically relax your body. That's very important. Do not stress. Main cause of in general also, like forget pregnant women, in general also, like stress and bad posture is also related your mental health. In general also, you will observe, like if you're stressed, your neck is down, your shoulders up, you get into that kind of posture, right? When you're
Right.
sitting, you slouch more. When you're happy, you straight. So again, avoid stress. Do meditation, do yoga. um, Eat well. Your calcium and iron tablets are very important in pregnancy, so eat well. Exercise in such a way that helps you to stretch and also strengthen. And do not forget all of these things in postpartum. Do not, whatever good things you were doing, like you didn't get any pain, you were very comfortable in your pregnancy, but postpartum in your fourth trimester, like stop doing it totally. So don't do that. Maintain it. Maybe it's not possible for everyone to do everything, but whatever you can do, take out time for yourself a little bit as you get easy. Educate yourself about different things, about the right posture, wrong posture. Ask for help whenever needed. um, Ask help from your healthcare providers. Ask help from your family members also. If something, it's okay if you're not able to do a few things, it's okay. Don't stress yourself on it also in your pregnancy and postpartum also. And if for especially new moms, be aware about your breastfeeding positions. Even if you're not breastfeeding and formula feeding your baby, you're using the bottle, to even be aware of that. Be very conscious of the way you're sitting, because that is going to lead, a lot of times most of them get really really bad upper back pain or neck pain in the postpartum period, in the breastfeeding period, because sometimes the baby is cluster feeding for like an hour, for a really long time. Then you're in that position, you don't want to move the baby. So वो सब चीज ध्यान में रख के ही you should breastfeed or that.
Wow, Disha, I'm like, thank you so much. Such a simple and straight way. I'm sure all the mommies who are listening to us, they all must be very well. Now they are all known to the topic, what to do, how to go ahead, who to take this guidance with, and very important what you said, everybody is different. Can't
Yeah,
say that ये posture हमें अपनाना है क्योंकि बोल दिया. You have to educate yourself that what are
right, right.
you are into.
Yeah, that's right. That's it. So thank you for having
So
having me here. It was a great talk. It was something really different, and I was really looking forward to this talk and this topic, which is, we all talk about labor, we all talk about breastfeeding, we talk about a lot of things, but posture is something which is,
yes.
very seldom talked about. So I'm happy that we did this.
And I'm very happy taking up this topic because this is something we have also not discovered for a long time, discussing about pregnancy, breastfeeding,
Right. Right.
requirements and everything. But this is a very important topic and it plays a very important role before pregnancy also and postpartum stage also. So,
Postpartum also. So, that's right. That's right.
thank you so much for taking out time for us. It was
Thank you for having me. It was great talking to you. Happy Women's Day in advance.
happy Women's Day to you also, dear, and to all the mommies in the next
Yeah.
all this a good posture, a good stance. It reflects a proper status of mind. So focus and take care of your posture during pregnancy and
After that.
thank you
Yeah.
so much. All in advance, happy Women's Day. Take care. Bye, dear.
Bye.